we had sold a robot into a particular hospital and they were having terrible outcomes. And we were asking ourselves, why aren't we selling any more robots in the marketplace? All we were thinking was, hey, they've got this brand new piece of technology. They should be super happy. They're using it. But in the background, they were telling people, man, it's tough to use. We're not getting the outcomes that we want. It's costing us a lot more money than we thought. And we weren't really listening to those people. We were just so focused on selling more products that we sort of missed the forest for the trees.
Welcome to the Medical Sales Accelerator Podcast. I'm Zed Williamson.
And I'm Clark Wiederhold.
This podcast exists to put scale to the value you get from those great one-to-one conversations at conferences and sales meetings.
It sounds cliche, but good products, they die every single day.
And that's why we're speaking with our guest today, Joseph Othman. He's the Western Area VP for Echo Health. He's an experienced medical device commercial leader with 20 years of bringing paradigm-changing tech to market, developing high-performance teams, and being an advocate for patients around the globe. Joseph, thank you so much for joining us today.
Thanks for having me, gentlemen.
So, Joseph, I'm being a little cliche here, but the reality is it's not just enough to have a good idea, right? Or to even have developed that idea to an actual prototype and product. There are so many things that can plague really intuitive and really well-designed product in the med device space that keeps it from either getting to market or realizing its true full potential in terms of helping patients and helping surgeons. I know that's a topic that you believe deeply in, and you've seen the good and the bad. Walk me through an example in your past where you kind of had that realization. It's not just about the idea.
Yeah, so there's a couple of them now, being 20 years into my career.
I bet.
And I guess what I'll start with is you hear a lot about robotics these days. Everybody seems to be developing a robot. Everybody seems to be acquiring robotics companies, and there's a lot of cool tech out there, no doubt about it.
Yeah.
And I think that nowadays, if you're having a soft tissue procedure done, or a hip or a knee, or you're getting implants in your spine and it's not being done robotically, chances are you're probably not with the right surgeon. But I think what has happened is that everyone wants to be like an Intuitive Surgical, or everyone wants to be like, Mako or Mazor, which was acquired by Medtronic. And what they don't maybe realize about that is how much, first of all, needs to be raised, right, to get to that point. You're talking about hundreds of millions of dollars that you need to go and secure. And then once you've secured it, the amount of R&D that needs to continue to progress, right? Just getting through the FDA alone is a difficult task. But then once you've gone out and you've brought that product to market, getting the feedback from the physicians that are going to be using it. Hey, is this really meeting your needs, or are we way off here? Do we have a cool product, but it may not meet the needs that you're looking for? And then once you've got all of that, really, that's where the rubber starts to meet the road, in that you've got to have a sales and marketing team that can really go push the envelope. Because I can tell you right now, back when I started at Intuitive, as an example, it's right on the heels of Hurricane Katrina. Everybody had lost their budgets because they were replacing buildings or HVAC systems or what have you. No one had a budget for surgical robotics, right? I can promise you that in today's day and age, very few people have a budget for artificial intelligence or machine learning. That's the beauty part about being in disruptive medtech, right? You've got to go show them the way. And so I think a lot of times, especially these founder CEOs, they'll say, man, we've got this amazing product. It's going to change the world. This is exactly what the market needs. And then they go and they hire salespeople who have been, let's just say on the commodity side.
Sure.
And they don't really understand that product life cycle. They don't really understand that crossing the chasm is a game for barbarians, if you will. One of my favorite books ever, Barbarians to Bureaucrats. And you've got to be comfortable with getting the door slammed in your face 25 times a day and getting up the next day and probably having that happen for weeks on end. And, you know, that's just some of the things that I don't think these companies really fully understand or appreciate. And I, quite frankly, I think it's why, in the robotics space at least, why I think Intuitive has built such a moat. You know, they figured it out. It was through a lot of hard work. It was through a lot of brilliant people being involved, but they continue to put a lot of money into R&D. They hire the best engineers, right? They've got the best of the best in every segment of that business, and they execute, they train. It's amazing to see what they've done, and then also the people that come out of that program, what they're able to go do in the marketplace. So I don't know if that answers your question, but that's, you know, there's just far more to it than developing a cool product, because there's plenty of those out there.
So true. You mentioned a book. What was the name of that?
Barbarians to Bureaucrats. And
Nice. I'm gonna have to check that out. I'm not familiar with it.
So that was sort of one of the books early on at Intuitive that they would have us read. And, you know, if you think about it, if you've got a disruptive piece of technology, what you don't want to have is a guy or a woman who has been in an ivory tower pushing buttons, you know, managing spend on a GPO. That's not the person you want to go push a disruptive piece of technology that the world has never heard of. You need somebody who's probably a little bit difficult to manage on a daily basis, but is okay with, you know, people telling them no. They're okay with difficult conversations. They're okay with the gatekeeper, you know, trying to keep them out. And so it's an amazing book, really great book.
I'm absolutely checking that out. We're also going to throw it in the show notes. You mentioned Crossing the Chasm. We were fortunate enough to have Jeffrey Moore join us, you know, episodes ago, and it's a great discussion because he's also got a book. You know, his most recent business book is Zone to Win, and he talks in that episode about the difference between the playbooks and Crossing the Chasm. There you go. Yeah. So everybody that's
screen, nice.
Yeah, everybody that's just listening and not seeing this on YouTube, Joseph just held up Zone to Win, which is just made my heart warm. That's awesome.
Yeah.
But that's a playbook of where to take, say, a disruptive playbook that you've been running out of Crossing the Chasm, and say when it's been purchased by a strategic, why there's so many issues that happen when that a purchase takes place, the culture migrates, the thinking changes, and the execution model. So it's super interesting.
Yeah. And again, I don't want to mention names, but I think it's pretty easy if you just look at my resume. But I just went through that where, you know, a big strategic came in and bought a technology that was on fire in the marketplace. And they went and put, you know, their people in place. They went and did all the things that they think are good for the technology, and it has struggled mightily under their purview. And so that book really resonated with me.
Yeah, I've seen it happen a few times myself personally with tech that I was intimately involved with at certain levels, right? And it's frustrating, but there's challenges on both sides. And I've come to appreciate some of the challenges on the acquirer side, right? It's difficult on both sides. Something you mentioned that I think is worth diving into is the difference between grabbing market share and creating markets. And what you were describing is the ability to go in and create a market that doesn't exist, create a marketplace for something that people don't even know they necessarily need or what they're missing out on at the moment. And that's different than just trying to gain market share for, something that already exists and you're swapping a widget. So
for sure,
where do you see, you mentioned bringing in talent that's used to, say, a commodity or a market share play, having trouble transitioning over to, you know, creating a marketplace. What other pitfalls have you witnessed in that transition?
if I'm going out and trying to create a marketplace and I'm looking at hiring people, what are some of the pitfalls that I've seen in terms of hiring people that are fit for creating a marketplace versus grabbing market share? Did I understand that correctly?
Yeah. I'll be a little more precise this time. So you've got disruptive technology and you're going to market. One pitfall could be hiring folks that have never lived in that world. They haven't experienced it yet. And so they're going to run a playbook, probably regardless of training, where they're trying to just gain market share. Aside from just the talent that you hire and the experience they bring to the table, what are some other pitfalls for an organization that is launching in to a disruptive, trying to create a disruptive marketplace?
Again, I think it goes back to constantly being able to be introspective, constantly being able to look at your product and say, hey, maybe my baby is a little ugly, right? And really being aware of all of the feedback that's being given to you on a daily basis, on a weekly basis, and quickly being able to pivot. Because what I have seen in the past is you'll have a product that you get into a few people's hands and they say, oh man, this is great. You know, I really need it. But then it doesn't get used, right? Again, I'll probably go back to Intuitive a lot just because I learned so much of what I use today from there. But early on, it wasn't really that difficult to get people to say, you know what? Yeah, I think this is where surgery needs to go. But then, you know, they'd sit on it, they'd play with it a little bit, and they'd say, well, you know, I don't know if I want to take 14 hours to do a prostatectomy. And so you kind of had to take that feedback that they were giving you and then go back to the discovery that you found out. Okay, well, what's important to you? Well, I want to be an innovator. I want to be ahead of the curve. And so you had to be able to kind of pivot. Yeah, it was going to have a learning curve associated with it for sure. But if you adopted it sooner rather than later, Mr. or Mrs. Surgeon, you could be one of the people to really get this thing to take off. And we're going to learn from you, and we're going to do this together. And I think that partnering with physicians that are early adopters, partnering with executives to understand how this is affecting, you know, their financials there at the hospital, speaking to patients about potentially what the technology did for them. All of those things you need to then sort of really think through, take your notes, and then use that to better yourself as you go for the next call. And there was a period of time there at Intuitive where I'll never forget. We had sold a robot into a particular hospital and they were having terrible outcomes. And we were asking ourselves, why aren't we selling any more robots in the marketplace? Well, because people talk, right?
Yeah.
And all we were thinking was, hey, they've got this brand new piece of technology. They should be super happy. They're using it. But in the background, they were telling people, man, it's tough to use. We're not getting the outcomes that we want. It's costing us a lot more money than we thought. And we weren't really listening to those people. We were just so focused on selling more products that we sort of missed the forest for the trees. And so I would say just be very thoughtful about what your customers are telling you. Try to make that experience of that first customer that you get amazing. Because if you do and you partner with them, then that's when the dominoes begin to fall a little bit. But it does go back to hiring, because if you don't have the right people who can sort of open their eyes and ears and really say, I want to learn from these folks, I'm not a know-it-all, then it's sort of a vicious cycle that you get in, right?
Yeah.
And so it's all about those cues early on and really listening and learning on the fly with the people that are taking a risk, taking a chance, who believe in you early on, and using that to sort of pour gas on the fire in the marketplace.
It's interesting. So at an early startup that I was with years ago, we we thought we had a great design, and we did, right? It was designed like a lot of the other instrumentation that this specialist would use, but they were using it in a much different manner. That was drastically different than, say, some tech that came from a separate specialty into, this was specifically an ENT, and we thought we had a better mousetrap. Okay, that's cool. But what we realized, and what some of our leadership realized, is we needed to also listen to the feedback coming back from the surgeons, those those innovators and early adopters, because we could resist and just say, well, we've got a better mousetrap, or we could listen and iteratively improve. And we did. And we made these little changes throughout the product lifecycle that drastically increased our usage because of those iterations. It sounds like that's what you're describing.
Yeah, we did not at the time, we did not really have an upstream marketing team, if you will.
Sure.
But what I've noticed is that the really good companies, what you'll see is that early on, as they're beginning to look forward to a launch of a product, or if they've just had a launch and they're sort of in that early stage where it's just with a handful of folks, limited release or limited launch or something along those lines, they'll have their engineers in that OR, right? Or they'll have their engineers in the facility working with those physicians, really listening to them. And to me, that is what really differentiates a company that thinks that they've got something versus a company that is going to just kill it. And it takes a little bit of extra money, kind of back to that initial discussion that we were having. You've got to think through that in advance, that, hey, I'm going to spend some money to have an upstream marketing person out in the field. I guarantee you most CEOs or startup folks, they probably don't think through that. They just would look at that as a line item cost. And in fact, it's super, super important.
Yeah, what comes to my mind is a concept of strong opinions held lightly. So you have a belief going in, that it's good to move forward. You're also not so blind to the feedback that you can't pivot. And I've always liked that way of thinking of it, is I'm going to have very strong opinions and I'm going to hold them lightly. Does that feel on board with what you're saying?
Yeah, it sure does. And I don't know if you guys know this story, and I might be boring you with this, but early on at Intuitive, when they came to market, it came to market as a technology for cardiac surgeons. And there was an old joke that they used to kind of throw around, that they aimed for the heart and they hit the prostate. And so I got there a couple of years after that they had gone commercial. And from what I heard from that early team was, you put all of this time and energy into a product that you think is going to change the world in cardiac surgery, which needed it, by the way, because it's a super invasive procedure, right?
Yeah.
And how accurate and precise you are in that procedure matters.
Yep.
So you put all this marketing, all this money, all this R&D into cardiac, and a urologist comes along and says, hey, good news, bad news. I've used it to take out a prostate. It took me 14 hours, but I think there's something there, right? And so for those early folks to say, well, we're not going to pivot completely, we built this for cardiac, so we've still got to pursue that avenue, but let's start to at least give some thought to maybe how this could work. And let's send some engineers and let's listen to these folks on how we can take a 14-hour procedure down to 8 and then maybe down to 2, that's commensurate with an open procedure. And that's how they pivoted, right? And that's how they really made their name, was on prostate. Had they not listened to that urologist, they wouldn't be the company that, everybody knows today.
When I think about our audience, I like to give them basically behavioral self-awareness tools. And what I mean by that is anybody in a high performance role, no matter what level, there's some form of blinders we have to put on, because otherwise we'll get too distracted and we won't achieve our goal. And there's a balance between completely blinding yourself to any kind of outside input and then also blinding yourself against enough to keep you on path. What kind of things are the people out there likely witnessing today that are signs that they may not be listening enough to the market, and they're macheting through the jungle because they're excited about their technology, but they're headed to a cliff that they don't know is there? What kind of things are they witnessing in their day-to-day business that might be like, hey, take a look at that?
Yeah, I think that if you've got a product that has already gotten into some accounts, I think the first big sign is when you start to see the utilization of that product peter off, right, or wane a little bit. And oftentimes people want to blame that on, oh, they went on vacation, or, you know, budgets got cut, or things along those lines. But if you really have something that's meaningful and it's a game changer for surgeons or physicians or for patients in that hospital, they'll find a way to use it, right? Mm-hmm. If they're really truly bought into it as something that they can't do without. So that's the one thing that I would say. The second thing is, and I'm not on here just to promote books, but I did just start in on a book called The Jolt Effect. Have you guys heard about this one?
Yeah.
You just read it? Okay.
Another author interview on the podcast.
Yeah.
Oh, perfect.
Matt Dixon. Yeah.
Yeah.
I love your taste.
Yeah.
I love your taste.
Challenger Sales, one of my favorites as well. And so,
Agreed.
You know, I think the thing that I took out of that is that here again, you know, every day, the good part of a really great salesperson is that they're resilient, right? They're super positive about every day is going to be a great day, no matter what yesterday was like. But in reading that book, I think one of the big telltale signs is that a lot of people are indecisive, right? And yeah. I think that was an eye-opener for me, in that more often than not, as medical device professionals, that's probably not something that we really think about, right? We don't think about that indecision and really the psychology behind that. We just think, oh, we've brought this great product forward. They're telling us yes, so therefore they're going to buy on our timeline, or therefore they're going to buy, period. When more often than not, according to that book, and I started to really kind of be a little bit introspective with myself and think back to my team's deals over the years, those signs have been there, and we just ignore them because we're too caught up in thinking we're going to change the world, right?
We're going to change the world. We are better than what they're doing. The data is behind us, and we're a very scientific and data-driven industry for good reason. But I think what you're describing, and it sounds like to me, you're saying that can blind us at times on the business development side to the reality of indecision on the customer side. Yeah,
correct. And funny enough, you had mentioned Omar earlier. Omar and I had done a deal rep where people bring their deals forward, and we really try to, you know, sort of cut that way back to the bone so that we can get to the meat of the matter, right? And figure out what it is that's really keeping these folks from getting that deal done. And I was corresponding with Omar the other day. I said, hey, I'd like to find out how those two people ended up doing, because almost immediately when we looked at that, it was like this jolt effect kind of hit me in the face. You know, these people are being indecisive because something else is going on in the background. And again, going back to the point we made just a few minutes ago, you've got to be in tune with what the market is saying, what the people you're calling on are saying. If you call somebody and they send you to voicemail one time, okay, that's one thing. If they send you to voicemail every single time you call them, you know, it's probably not going your way, right? You may want to get in the car and drive there and see if you can get in front of the person. Yeah. And so that's kind of the way I see it right now in the marketplace. I think something else, just from a more macro perspective, is that I think that hospitals and health systems are in a real weird place right now. They're having tough times with labor, right? They're still coming off of COVID. Inflation is hurting them just like it's hurting everybody else. And so I feel as though a lot of people just want to go in and push their product, and they don't really give consideration to what those folks are going through on a day-to-day basis.
Yeah.
And so I forget where I heard it the other day, but somebody said, stop pushing your product and really start thinking about a solution that might be best for the position that they're in right now. And so I see that. I've been guilty of it, right? I've got a job. I need to go do it. I need to impress my boss. I want to make more money. But maybe this customer is not the right one at this stage in the game. And I need to go find somebody else that my solution can really help, instead of just thinking, I've got a hammer and everybody out there is a nail.
The only thing I would add to that is, when I've walked through that thought exercise myself, I've had the realization in the past that if I take the features and benefits off of the marketing piece that we have, because it's the one size fits most strategy, that I actually had massive benefit for for the issue that my customer was facing. I just needed to articulate it in a different manner. It just was a different lens to look through. And all of a sudden, I was a good fit for what they were dealing with. So I would encourage people to also think through, genuinely take Joseph's advice and genuinely look through the issues your customers are dealing with now, and then reevaluate what you bring to the table and how you position that the value itself.
Yeah.
It's interesting because what we're talking about here, and this is going to be a blatant self-plug, but we had the conversation with Matt Dixon, who wrote the Jolt Effect, and what you're witnessing in the marketplace with this indecision, this is tied to bias. This is tied to heuristics.
100%.
And the company that's a sponsor of this podcast, the reason that we get hired so often by medical device companies is because they're sick and tired of doing this voice of the customer that is this just kind of top of the layer, like, hey, yeah, your stuff is nice. And the approach we take is, imagine a voice of the customer that's rooted in neuroscience, and let's dig into the actual behavioral triggers of the surgeon and why they're indecisive. And guess what? The answer is not lack of data. You are not going to over data yourself into a sale, but that's typically what the industry does. And so we'll get hired by medical device companies to dig in to the heuristics, the neuroscience, the actual human behavior behind that indecision, which is why I really loved the Jolt Effect as a book. It was like, this is awesome. But there's so many biases, so many heuristics out there that are massive barriers. And the rock star salesperson who has the ability to charge the hill over and over and not get tired, get told no, it's fine. When you actually give that person a couple more tools to interact with those specific biases, holy moly, the floodgates can open again. So it's really it's an interesting place that we're in. Our society is creating it. We're creating indecision with access to information, use of cell phones, speed to data. And so if you are just trying to run the same offense that you ran in the 70s, 80s, 90s, and the 2000s, and we're going to quickly be able to say in the 2010s or however you'd word it, it's just, you're going to fall flat.
Yeah, without a doubt. And funny enough, if you really take a look at, again, back to Intuitive, they had a really amazing playbook that I think a lot of the components of it still make sense today.
Sure.
But what's a little bit different about it is that, most physicians are now owned by hospitals or health systems, right? That was a major difference from where Intuitive was early on.
Yeah.
You look at things like market development activities. You look at things like the fact that Intuitive was a monopoly, if you will, quote unquote, back in the day. And so I hear a lot of people say, oh, we're going to take that playbook and overlay it on this other company, and what they're not really thinking through is what you just discussed, right? What is the data telling me about this customer? If it's a bunch of physicians that are owned by the hospital, well, chances are they're not going to leave that hospital to go somewhere else, right? If the hospital doesn't get them the technology that they're asking for. So, all right, you gotta get rid of that play in your playbook, right?
Yeah.
You know, and hey, maybe the hospital is going through an acquisition. Maybe they just got picked up by one of the larger health systems in the US, and they're transitioning between one CEO to another. Well, you might want to consider that, because chances are they're not thinking about you right now. They're thinking about larger things, right? And so those data points, I'm with you 100%, are needed. And I think the more you can tap into what people may be thinking and what's on their minds, and what's keeping them awake at night, I love those sort of technologies that can help along those processes. But the old, let's just overlay this playbook on the other, that's got to be something that goes out the window. You need to learn from the past, use some of those things in the future to help you get better, but you just can't
plug and play
with one
if
to
you
the other. It's changed too much.
Just use sports. Imagine taking the playbook of the 2011 New Orleans Saints and force some other team to run that exact playbook this year. It's not going to work. So why do we think business is different? Yeah.
And I saw that early on. I left Intuitive and went to a company called Xenex, which was a little robot in the disinfecting space. And of course, here I am coming out of Intuitive thinking that I know it all, when I know very little really about the world outside of just that space. And I come over and I build the exact same playbook. I use all the same plays, but with a group of different players, number one, and number two, calling on completely different call points. And almost immediately out the gates, everybody was like, hey man, you need to pivot, because if you continue down this road, you're gonna fail really, really hard. And thank God I had some people who, course corrected me along the way. If not for that, I probably would have just, continued on doing what I knew. So that kind of goes back to some of the other points that you were making about, as you're beginning to hire people with a diverse background, hire people that, have maybe had some experience. They don't need all the experience in that exact space, but they have, high character, high capacity, high energy. Look for those things so that you don't come in with just those same ways of doing things.
When you were talking about thinking through your customer, whether it's one of the professional buyers within the institution, or maybe it's the surgeon themselves, what are the challenges they're dealing with right now? What is administration dealing with? I mean, you talked about the hiring scenario. Like, you've got lots of wage inflation pressure at these facilities. You've got the ability to bring in, anesthesia as a department alone is just upside down in a lot of places. And then you're dealing with the owners of a lot of the companies like that they're aging out, and they just don't want to put up the fight because it's tough and it's disrupting everything, right? What pressure does that put on your customer? How can you pivot your value? It makes me think about one of the earlier episodes of this podcast, actually, which is this is like the plug episode of the century, but with Carlos Calix, where he's with a big institution. He comes from med device and med tech, and now he's on the hospital side. And he really emphasizes the fact that they have goals internally as well. And so if you can align yourself with their internal goals of what they're trying to accomplish, their business objectives, you can make the process much smoother if you start to uncover that they have objectives they need to meet as well. And I couldn't help but think of that when you were describing that, Joseph.
Yeah, we talked about it a little bit on Omar's podcast, and I think it's something that I see more often than not. People just generally miss because they're in such a hurry to really sit down with whoever it is that you're meeting with and ask them what is important to them. What are the metrics that they are being measured against? and open your ears, take a lot of notes, really listen to those folks that you're meeting with, and then say, you know what, do you mind if I get back to you? And really formulate a plan that says, okay, this person's having issues with hiring. Can I potentially, instead of reading from the marketing materials, can I potentially, find a way to position my product so that is an absolute solution that they are going to want to use, not just now, but maybe after some of those issues that they're having eventually get fixed, right? So you've got to bring them multiple different value propositions that help them in the here and now, but also help them into the future. And I think what I see is just this show up and throw up. Let me just talk to you about everything that I can about my product. And I don't know, my father has a high school education, but ran a very successful family business for a number of years. And his whole thing that he would tell us growing up is just shut up and listen. Let people talk about themselves. Be interested in understanding what other people have to say about themselves. And you'll learn a lot about them. You'll learn about yourself. But all too often today, especially with Zoom, you've got an hour that you have to get through this meeting, and come hell or high water, you're going to get through your slides, right? You're going to talk about your
get
product.
to slide 22.
Right. I'm going to get there. I promise you. And I just don't see hey, this should be about you. Tell me about you. Tell me about what your concerns are, your issues, your hurdles. And then if we don't get to us, that's fine. I'll get there at some point. But imagine how powerful that is if then you can get back to them and say, I've come up with a customized solution to meet your needs.
I saw a video of a presentation just recently. It was 50 minutes long. The person spoke 98% of the time, and also acknowledged multiple times that this is probably good material to fall asleep to, and still just push through and hit like 57 slides. It was one of the most brutal things I've ever watched. I wanted to tear my face off. Like, it was brutal. But people think it's their job to get to slide 22, or they think it's their job if they only hear how cool this bullet point is. No, dude, shut up, listen.
And it goes to whether you're in that product development stage or whether you're presenting that product to somebody. It fits all along that product life cycle and the sales life cycle. And I just think more often than not, my wife probably even tells me, just, hey, listen to me for a second, put down your phone, stop focusing in on other things. And while we've got a great relationship, if I listen more, it'd probably even be better. I'd get yelled at far less.
To me, listening to our conversation, I keep getting the feeling of going back to what's the intent? Because if the intent is for me as a, individual contributor out there in a sales role, or as a product marketer, or as the VP of marketing at a company, if the intent of what I'm creating and what the actions I'm taking is to just get through it, then you're just going to try to power through your PowerPoint or whatever, delivery mechanism for your message you've got. If the intent is for me to understand so that I can, one, make sure I've got going back to your earlier point, Joseph, is this client the right fit, and are they ready now from my assessment? And then can I get their indecision out of their way? If that's my intent, I'm probably going to do things a lot differently, like listen, because I want to learn what are the things I don't know that before I walked in the door, because that's going to help them get out of their way. I'm going to learn a lot more if I just pay attention to them versus walking through everything that I know about what we could do. And it feels like that's what you're describing to me, is walk in with some intent. And if the intent is for me to help them get out of their own way, the sales call or the discussion with a marketing leader is going to be drastically different with that client.
Yeah. I mean, I say it all the time. I'm so lucky to be able to be in an industry where if I'm with a good product and a good company, that can truly have a positive impact on somebody's life, right? And I don't take that lightly. And so I think part of what what we're talking about here is being more mission driven than just, product driven or sales driven, right?
Sure.
Really believing in what you're doing is going to make a difference. And if you sit there and you listen to somebody, what you're doing is you're trying to find a way to essentially ensure that when your product does get sold, that it gets used in the appropriate manner, that, in a lot of cases, it's more of a program versus just a product.
Yep.
I can tell you right now, I just was telling you guys, I had cervical spine surgery about a month ago, and that surgeon did very little talking to me up front. It was almost like we were preparing for a trial. I mean, he sat there and he asked me question after question after question after question, because he wanted to know what my expectations were. He wanted to know what, my current physical limitations were, where the pain was. And so when he did speak, it really felt amazing, because it felt like there was somebody who sat and listened to me, and he came up with an approach that maybe he uses for everybody. I don't know, but it felt tailor-made, right? It felt very personalized. And it's why I went with him versus the 20 other people that I had seen before that said, hey, we're just going to put this disc in your neck and,
right,
you'll be fine. No worries. He took the time to listen to me and understood, what my concerns were. And hopefully that is something as a leader I can continue to really teach people how to do. You got 2 ears and 1 mouth, that whole adage.
Right.
Yeah.
Well, Joseph, I really appreciate you taking the time to join us today. This is an important topic, and I hope people take these nuggets, apply them to their day-to-day, be self-aware. If someone wants to reach out to you to connect, is it okay if they do so on LinkedIn?
Of course.
Great. We will put a link in the show notes directly to your LinkedIn. And our listeners, you should visit medicalsalesaccelerator.com. When you do so, you can do a couple things. First of all, download resources to help you communicate better with your customers. Notice the theme. You can sign up for emails to find out about upcoming episodes or past episodes. And you can also submit suggestions for topics or guests.
If you found value in today's episode, and you better have found value in today's episode because it was killer, I want you to do a few things for me. Drop some stars. We love the 5 stars. Please leave a review. Subscribe to the podcast if you haven't done so. And go to the box with the arrow at the top. Send this episode to your friends, your family, your mama and your daddy. We greatly appreciate it. Joseph, thanks for joining us again. Make it a great week, everybody.